Hello, patients of the Bandon Community Health Center and Dr. Gail McClave. You have been diagnosed with BPPV, or benign paroxysmal positional vertigo. That causes all kinds of nausea, vomiting, and nastiness. However, the upside is that there's a very easy way to treat this, and you can do it in the comfort of your own home. We would suggest that this is the best way to do it only if you have a diagnosis and you've been given this video by Dr. McClave or Deb Guzman, the nurse practitioner down there. My name is Mike Kiefer. I'm a medical student rotating through the clinic, and I'm going to show you how to do what we call the Epley maneuver, which is something that usually is done in the midst of a physical therapist's office or sometimes a physician's office. But the truth of the matter is you can probably easily do it here in your own home if you have a similar size like ottoman or bench that you can easily maneuver from one side to the other, and you can rest your back against while dangling your head over the side. And I'll show you what I mean here in a second, okay? So the first part of the Epley maneuver, when you are having symptoms of vertigo or the room is spinning, is to be able to tip yourself back really quickly. Now, this is always one of those things that if you're uncomfortable doing it very quickly, it might be best to have a practitioner help you with it once at least. But you should be able to see it in the video that you're capable of moving back into a position where your head will be dangling over the back end of this couch or seated chair, and move to the first position. So what you want to do is you sit with your legs, you want to sit here, and then sort of get into a position where you can be tipped back easily and support the whole of your back with the exception of your head. So what happens in the first position is that you go all the way back and turn your head to an angle like this, and I'll show you. You have to go pretty quick. Like that. All right? One of the important things to have this done when you are in the midst of doing this is to have a watch handy or a friend who can watch the clock for you, because you want to stay in this position with the head sort of tilted towards the floor, dangling off the side, and this helps to maneuver the little rocks that are rolling around in the bony parts that are rolling around in the inner ear to resettle far away from the nerve endings that would be sensing your balance being a little off. Okay? So what you want to do is stay in this position for a total of 2 minutes. So I'm going to look at my non-existent watch here and see that I have come to the end of those 2 minutes. And then I want to go ahead and turn my head 90 degrees to this position. Okay? And you want to stay here for 2 minutes. And I'm going to go ahead and skip ahead in time and look at my non-existent watch one more time and see that the 2 minutes has come to an end. And then I'm going to, with my whole body, rotate to the other side of the couch so that I am on my side, dangling my head over the side, similar to that first position. All right, looking towards the floor. This is another 90 degrees away from the second position. And then you wait for another 2 minutes. Once the 2 minutes is up, you can go ahead and look at your watch again. Hopefully your glasses aren't falling off like mine are. And once that time is up, okay, you just tuck your chin into your chest and push yourself up into a seated position, and you just stay there for 10 minutes, 10 minutes, 10 minutes. And, enjoy the scenery, have someone turn on some music for you, and just sit there. This will complete the full Epley maneuver, and when 10 minutes has come and gone, you can sit, you can go about your day. You should have no more symptoms of nausea or vomiting, and the vertigo should have resolved. So I want to thank you for watching this video on how to perform the Epley maneuver.